Hi, I'm Jennifer Craig, and I am an emergency department physician at Delta County Memorial Hospital. I have been working with the incident command team at Delta County Memorial Hospital to make sure that we are doing our best to keep our community safe, our staff safe, and our hospital prepared in the event of a coronavirus outbreak. Now that we've had a positive case in Delta County, we wanted to be sure that we are clear on what we are doing as a hospital, what we are doing in the emergency department, and what we would like the community members to do to keep themselves as safe as possible. In the emergency department, we have been implementing measures to make sure that we are protecting against infection as much as we can. We are requiring everybody who comes into our emergency department to be wearing a mask. We have divided our department into two sections to try to keep sick people away from well people who may need to be seen. We are open for business, but you'll probably be screened at the door before we bring you into our department, so you should expect that. Additionally, in the hospital, we're also implementing measures to keep our employees safe, which will probably include the employees wearing masks at all times. We are starting to limit our visitors, and those limitations will probably become more strict. Additionally, we are together with our caregivers and our hospitalists and several qualified doctors arranging plans to expand our services and make sure that we have the resources to care for possibly critically ill respiratory patients. We are working in conjunction with our respiratory therapy team to make sure that we are ready in the event of critical need for these services. We are trying to keep the population up to date as far as precautions. We encourage everybody to continue the social distancing, self-quarantining if you are sick at all, trying to limit your contact with other people. We would really appreciate if you refrain from being in groups of people and try to be smart about what you're doing out in the public arena. We are no longer doing any sort of community testing. We have a critical shortage of COVID tests. This is a statewide phenomenon, and we are trying to reserve those for the people who are the sickest or are essential workers both in the county and the community and in our hospital. So this is the reason we're no longer doing community tests per se, but if you are sick and you feel like you may need to be tested, you can contact your primary caregiver and they will make recommendations as to if you need to be tested or not. So we do have several outpatient clinics. They are affiliated with Delta County Memorial Hospital, and there are some private clinics as well. We are also putting in place guidelines for these clinics. You should call your primary clinic before you go in. They can give you some information as to how you need to approach that clinic, where you should go given your symptoms. We will be routing people through our clinics in different manners depending on what your symptoms are. We will try to dedicate caregivers to potential coronavirus patients, and we'll try to protect you and our caregivers as much as possible. Our urgent care facility is currently caring for the majority of the sick patients in the county who don't feel like they need emergency services. You can always go to the urgent care. You will be screened when you approach the urgent care as to if you have any symptoms of COVID, and based on that, you'll be routed through the urgent care. If you feel like you are sick enough that you need to be seen, those symptoms would include things such as fever greater than 101, cough, shortness of breath, any difficulty breathing. There has been some gastrointestinal symptoms in rare cases, but the majority of these have been more flu-like symptoms. And so if you feel like you are sick and you cannot stay home with the symptoms that you have, then you should approach the urgent care. Of course, if you feel like you're critically sick or need emergent attention, we would want you to come through the emergency department. I would call in the event that you are sick and feel that you may need to be seen, but you have a primary care provider. I would first call your primary care office and they will give you recommendations as to where you need to be seen. This is a dynamic situation, and this situation likely will change over the next few days as we have more and more people who need to be seen. And so we may send you towards the urgent care for a while, but then your primary care clinic may also start seeing patients who do need to be seen with symptoms. And so this will be a changing and dynamic situation. So we recently have equipped all of our clinics with the ability to perform telemedicine. That is the ability of our providers to reach out through an interface such as Zoom and have visits where you don't necessarily have a face-to-face visit with your provider and don't have to go into the clinic. Appropriate visits for this are things like medication refills, routine checkups, and maybe a blood pressure check where you have a log and you can talk to your provider. Currently, our providers are screening their patients, their patient list for the day, and are trying to sort who can be treated with telemedicine and who cannot. In the case that they feel like that's appropriate, they may call you and ask you to do a telemedicine visit. If you feel like you have a non-sick visit but need to be seen, I would encourage you to approach your primary care provider, and they will let you know whether this is a possibility for you to stay home and have a telemedicine visit. As there is some confusion as to what we mean by self-quarantine versus social isolation or social distancing, and the guidelines are this: if you have not been exposed and you are not currently ill, then you should practice social distancing in order to just try to slow down any spread or possibility that you will get sick. This involves staying 6 feet away from people, not being in large groups. The governor's mandate, I believe, is groups larger than 10 should not be meeting together. And you should try to stay only around well people. So if somebody in your family is sick, you should then consider more of a quarantine situation for that person. That would be that person eliminates putting themselves in public at all. They stay home, rest, drink water, treat yourself appropriately, maybe get some guidance from your primary caregiver as to how you should treat yourself, but we want you to stay home and not go out in public. When you're social distancing, you can go to the store, just don't get too close to other people and get what you need and try to go home. But certainly, especially in our younger groups of people, we don't want you hanging out in large groups of people, and with kids off of school, they're wanting to get together with their friends, and we would discourage that. Currently, we're also facing a critical need for our personal protective equipment. This becomes just essential for us in these situations as healthcare workers. Our demand is great, and we go through a lot of this equipment in trying to protect ourselves and our patients from any possible exposure to coronavirus, and also when treating patients who possibly have it. We are facing shortages of masks, N95 masks, and protective gowns. And so we are trying our best to conserve them and have policies that conserve these resources. But we are reaching out to the community and asking if anyone has surgical masks, N95 masks that are not soiled, and or any sort of surgical gowns that perhaps they would donate them to us. We would really appreciate that. Additionally, we're reaching out to the community to make masks, face shields, and perhaps gowns, but there are certain criteria that need to be met for these masks to be safe and protective. So before anyone starts sewing these items, we would want you to get in touch with a task force we are putting together that will have the regulations and the materials that need to be used in these protective equipment if you are going to make them. So we appreciate everybody's help with this, and I think that it will be a fantastic resource for the hospital, but we just want to make sure we're making them in an appropriate way that keeps everybody safe. Overall, I want to encourage everybody that we will get through this. Obviously, it's having a great impact on the systems, our everyday life, our economy, but the majority of people who come in contact with this virus are going to be fine. We, of course, want to keep our high-risk populations from getting sick, and those include people over 65, anybody with any immunodeficiencies, or other significant medical illnesses. But at the end of this, I think we're going to come out of this as a stronger community. I think all of the policies and procedures we are putting into place are phenomenal and probably will be far-reaching into the future for our hospital and for our community, and should we ever need to respond to something such as this again, we will all be more experienced and better at it. Certainly in the last 2 weeks, I've seen us all grow as a community, and it's been amazing to see everybody come together and really learn how to work together. I think life will get back to normal. We just need to ride this out and stay safe, support our community and the efforts to keep everybody safe, and really not panic. And please just utilize the resources that we're providing. We're here for you, and we intend to be here for you. We're going to do our best to take care of everybody.